remind people as they come on.
This meeting is being recorded.
That that the meeting is recorded and that it will be on a public website.
Thank you so much.
Yep. Yeah, no problem.
Tiffany, this is John Barry. I see we're doing that, so let me just say for the record, folks, that please be mindful of PHI, protected health information, that you may be sharing in the meeting, knowing that this is for public record. So please.
John Barry, John, I appreciate your statement, and I think it's certainly necessary. I will say, if I choose to share my own information, that's my business.
For sure.
That is, I agree with that, Jose. I was just wanting people to have a conscious choice about it. Yep.
Thank you so much.
All right. Well, let's go on to roles and responsibilities of this group of people. Again, this is review from last week. So like I mentioned earlier, myself, Nicolette, and John Barry will be doing the facilitating. We'll do introductions, walking through background, timekeeping, monitoring questions in the queue, and really just overall flow of the meeting. We will also have department subject matter experts, and they are the people that are responsible for the actual writing of the rules, the language that's chosen, and they'll be addressing questions. They'll walk you through the updates and any changes and the reasons for those changes, if there are any. Again, they'll address questions or concerns, comments. These will really be the people who are answering those questions on the back end in writing on those logs. And then last, we have our contractor, HCBS Strategies. You heard Steve here, who hopped on, and they're responsible for all of that back end stuff of organizing the logs, making sure that everything that's talked about today and in our forthcoming meetings are captured in those logs. So if you see something that you think is missing, they're the folks that we're going to be working with to make sure that those things are captured and captured accurately. And then they'll be ensuring that we have answers to your questions and supporting subject matter experts with any background information, history, context, anything like that that might be needed. All right, so that is our introduction. This will be the team of people working on these rule revisions from the department. We really appreciate all of you being here and being invested in this rule process. As we know, it's really important to you, it's really important to us, and I'm so grateful that we can partner together on this. So any other questions about the rule structure, the rule meetings, roles or responsibilities that we can address before kind of getting into the meat and potatoes of today?
Yes, one thing. I want to clarify something, and just make sure that I'm the same page than the department. Sounds like you are making these meetings just to inform us about the changes. You're not expecting to actually have feedback. And am I understanding that correctly?
No, so we will, thank you for that question, because I think it's a really important clarification. These meetings, the department will present proposed changes, where the department has taken, right, we've been doing case management redesign for years now. We've been getting stakeholder input for years now. We are going to propose changes in the materials. They will be offered to you all to review beforehand. And this will be sort of like listening sessions, where this will be our space for you all to give feedback, provide comments, ask questions, give other ideas about what needs to be included in that particular set of rules or documents that we're reviewing.
Thank you so much for the clarification.
Yeah. John Barry?
Yeah, Tiffany, I just want to jump in, and Jose, thank you for your questions. I do want to remind people we are using the speaker queue. And if people start jumping in like that with questions, we could have chaos very quickly. We do have over 145 people in the meeting. So I see a bunch of names in the chat, and I have a feeling people were putting that in there for attendance purposes. So when Tiffany asks for questions or comments, you can type your name into the chat to get into the speaker's queue by saying, for example, John for the queue. That way I'll know it's not an attendance message to us. Just wanted to remind you all. Thank you.
Thank you, Jim.
Thanks, John, for the reminder. I'm probably going to need those reminders too. I forget about that too. So
I also
great.
have a link that you can go to instead to put in your information so that we don't have to add the names to the chat. I'm going to pop that in one more time here. There we go.
So are there any other comments or questions at this point for the queue? You can raise your hand in the webinar. You can type your name into the chat. For example, John for the queue. You can unmute your phone by pressing *6 right now and give me your name. Anyone?
John, I see one question from Charlene in the chat.
Very good.
I can ask my question out loud if you'd like. I am just wondering, when you mentioned feedback, will you be making any changes from this feedback? I'm trying to understand the purpose of taking feedback. If you say you've been listening to that for a long time and that's how you've developed what are the chances? What is the process if you do make amendments or changes to these rules?
Yeah, I think that's a great question. I expect that there will be changes made based on feedback that we get here. Obviously, that will be dependent on what the feedback is and, the department staff's particular process with that. We're going to work really hard to incorporate as much as we can of the feedback and make those changes and updates, because clearly if you all are taking the time to give that feedback, that feels important. We're obviously not going to be able to use every piece of feedback. And so the commitment that you have from us at the department is that we know this is serious for all of you and we take it really seriously. And so we're sort of presenting our interpretation of the feedback we've gotten. And this is your opportunity to tell us, yep, you got it right, or no, you're way off, or we want this sort of nuance in there that's clear, that is not clear in what has been proposed. Does that sort of make sense? I can't say like, yes, absolutely, every single time someone gives feedback, we'll incorporate that. But
and we have developed the listening log as a mechanism for documenting the feedback, and we've done the status on here to kind of show you guys what is the status of it. So the department has committed to documenting the feedback, and then if they cannot accept it or they're accepting it with modification, they're going to be providing you the rationale for that. This is a document, the link was shared in the previous presentation, so it's a public document. You guys can see it at any time. You can't make changes to it. That is locked. However, if there's something that you want to add to the listening log, or if there's something that you think incorrectly reflects what you said, then just send me an email at steve@hcbs.info and we will update it.
And Steve and Tiffany, will you be able to tell us when there's feedback given and there's written in the listening log? Could you tell us later on if that particular feedback was used or not?
Yep.
Which one was?
That's going to be part of the process. That it's
Okay.
going to be given the status. You'll be able to see, right now with the two current things, I put it as under review. If this is something that I imagine this one will be accepted, once we make sure that's incorporated into the rule, would move this to accepted, and we would note here that this is incorporated into the case management agency rules on it. We might even, if we have like a specific number, be able to reference it to the specific number. So, and Charlene, in response to your question about like changes to the process on this, last meeting we proposed all of this to you to see if this was a process that makes sense. As we go through it, if you see that there's things that are not working and you have recommendations for improvement, we would love to hear them.
All right, or do you have any current? It looks like you have no current. Well, wait a minute, I can't really tell.
These are ones from the meeting that we heard from the questions.
Yeah,
from
you've got ones on. Okay, so you have a list begun.
Yeah.
And Nicola actually just put the link in the chat directly to those listening logs that are posted on our Case Management Redesign webpage. And then we have the listening log, and then we have issues for further discussion. So those will be, like I said earlier, the issues that might be outside of the rule topics or something that we need to spend some more time discussing.
Yep. And during the last meeting, we had a couple of those that came up. So if you look at there, you'll see the ones from the previous meeting.
Tiffany, this is John. We have a question in the chat from Marie. Seems kind of foundational. So really good one. For clarification, this is more than case management redesign. It is also regs and rules changes that affect more than case management redesign.
Yeah, so the way that that the department sort of envisions case management redesign is it's really this big umbrella that oversees all of those operational changes that we will be talking about in rule and regulation. So that's why we're calling it case management redesign, rule and regulation revision, because it really is, case management redesign permeates everything, right? So even when we talk about benefits and provider qualification, less about provider qualifications, but in benefits, a lot of times we look at, or there is specific requirements that the case manager has to do, and it says single entry point case manager. We have to open those rules and change that to case management agency, case manager. And then we have to make sure that that responsibility is reflected in the case management responsibilities, which currently we only have them in that one place, right? So, so yes, it is bigger than just case management agencies changing. It is bigger than just case management responsibilities changing. We're really using this as an opportunity to change the structure of our rules, to change really, how we are looking at our rules.
However, Tiffany, correct me if I'm overstepping on here. The content is going to be focused on just the case management and the components that are necessary for the case management redesign, while the placement of the regulations for the waivers and so forth will change with restructuring the rules. The content for like service definitions or for eligibility criteria, that's not part of what we will be discussing or presenting here. There's no changes that would be discussed here.
That's right. Yes.
Tiffany, we have a follow-up where he said saying thank you, but it also is a definition of services, et cetera, correct?
We will be talking about definitions of services, but as Steve said, we are not changing those definitions. It really is about incorporating those into the new structure.
Right. Thank you. And Jose, we noting your request or suggestion about emails. Thank you, Jose.
Yeah, thank you. And I also wanted to add one more thing. And I'm sorry to add it to the microphone. I'm not that good typing. So it's helpful to have information that we're going to talk about ahead of time. And the best time is to have it 2 weeks ahead of time. And I know that that's really hard right now because we're talking about every 2 weeks meeting, and I get it. But But I can tell you that as someone who has done work for the department with the leadership of Mona and Julie, we can make it happen. It's happening. It's doable. It's something that is doable. When you are required to give information ahead of time for the specific meetings, you just plan it that way, right? So I please request that these informations are distributed to the people who are normally in attendance, and later we can, you guys can decide to amplify that list depending on the people that are attending the actual meetings, and to send information ahead of time, and also to send the regular documents that we are going to use, as well as a reminder for, like, the Zoom meetings and all that, because Mona did that in the community calendar that we share with John Berry in our website that we created because of HICPA's request to create a specific website to deal with the CMRD, and also to deal with the lock screen tool and all the policy issues that HCBS is working on with HICPA. So we have that website and we keep working on it. We keep adding more information to it. I'm happy to share it if people want to see it. And that's a great tool, because that way you and I mean, talking to HICPA mainly, we can keep each other accountable.
Great. Thank you, Jose. We will document that request and put that in on our list. We do need to move on. So if you have further questions, please feel free to put those in the chat or email me or Nicolette, and we will make sure to add those to our list also. So moving on to our case management redesign structure. So I wanted to start with a little bit of history. So you saw on the agenda and in the slides that we're going to talk about waiver applications and updates, but want to give you some background about how we got here, how we kind of chose this particular path, specifically as it relates to our waiver application that Julie Masters is going to talk about, called the 1915 B4. So Colorado, as you know, is already unique in our case management structure. We have more waivers than any other state. We have a really unique system for dissemination of services and supports. We are already different and apart from other states. So, we looked at what other states were doing, what other states were doing to come into compliance with conflict-free case management. And we didn't see a lot of great fits to mimic our system after. We didn't want to just come into compliance with conflict-free case management, which we are one of the last states to do so. So we had actually a lot of material to look at and successes and failures from other states. But as Colorado looked at our options, we really wanted to be more mindful of member needs and more thoughtful of how we will serve members and the impact that this change would bring our case management system. So we spoke to stakeholders who cared about the quality and accountability of their case management agency more than they did about being able to choose their case management agency. We have a pretty, again, as you're probably aware, a siloed system that causes a lot of confusion for people, people not getting their needs met, people not knowing where to go or having to go to different places based on their disability, and really not being able to support a person regardless of what they needed. So Office of Community Living Leadership really dug deep and really wanted to look at a system where we weren't just coming into compliance with Case Management Redesign, but we were looking at what members and families actually cared about. And what they heard was people wanted a system where we no longer look at or separate or assess people based on their disability, but rather really discussing and talking about the needs of each individual and serving each person as a whole person, not just as a participant on a particular program. So when families and individuals are met with unforeseen hardships, how can our case management structure support them? And the hope is really to have each individual that we're serving to experience a system that that met their needs in that conflict-free environment. So next slide. Oh, sorry. Can you go back one more slide? So our waivers, so we had to take these 3 different types of case management for 10 different waivers. We have single entry points for long-term services and supports waivers, community center boards for IDD waivers, private case management agencies for CHCBS. We had to take all of these different populations and figure out how to achieve the vision to improve member experiences and ultimately improve member access to services and support. A system where, again, we're no longer looking at and separating by specific disabilities, but rather discussing the needs of each person as a whole and making sure that those needs are getting met. Next slide. So to this end, our Office of Community Living Leadership, again, worked with stakeholders a couple of years ago to create these 5 key outcomes for case management redesign. They knew that Colorado needed to come into compliance with conflict-free case management, which is our federal compliance. Like we really needed to come into compliance because we couldn't add services or programs. Those couldn't be approved without being in compliance with conflict-free case management. So hear me clearly, we did not choose this process. We did not choose to be required to come into conflict-free case management compliance. This was chosen for us in order for us to, for Colorado to move forward and to add programs to our already existing programs or services, to our already existing services. But we couldn't come into compliance without also, or we didn't want to come into compliance without also addressing the concerns that we hear from you all on a regular basis around case manager customer service, member experiences, and again, really just getting needs met by your case management. So, so stakeholders asked leadership to address issues with quality, accountability, and lack of stability across the system, so that there's consistency across the state and that improved customer service and quality outcomes. Stakeholders also asked that we resolve how complicated the system is and make it more simple. Again, not based on disability, but based on need for services. There are other paths that Colorado could have taken that would not have addressed these things, especially not have addressed simplicity. Some of you will remember that the department initially wanted to have a third-party broker as part of the eligibility process, but this was before my time, but what I heard was that there was an outcry from stakeholders that, gosh, this really, really complicated the system and in an unnecessary way for members, especially people just coming into the system. And so these key outcomes are really the filter that the department uses in making policy decisions and ultimately finding the path that that led us to our house model. So next slide, please. So as department leadership looked at other states, looked at those 5 key outcomes, use that as their filter, this house model is what seemed like the best option. So having case management activities and services all under one roof, for all individuals, all waivers, all programs. I will note that this does not include early intervention. That is a separate process through the Colorado Department of Human Services. Sorry, I had a blank for a minute. But department staff is working closely with that department to ensure that there are not unintended consequences and that our timelines are syncing as much as possible. So with this house model, we have all case management agency functions in one place. Members can go to one place to get their needs met in their community, regardless of their disability or which program they want to apply for. This brings the simplicity and stability that stakeholders are looking for. And then the department will be implementing standardized training and quality support directly for case management agencies and to address that quality and accountability. We'll also have a process called continuous quality improvement, which we'll talk about more in the case management section of the rules. But this is sort of the basics of what we're looking at. So let's go to the next slide. So as the department began looking at implementation options, he realized that, the current payment structure for the different types of case management, they did not align. So Steve is going to talk here about 2 examples of these discrepancies and what the department is working with our federal partners, CMS, on aligning our funding and payment structures.
Okay, and I do note that Michelle has a question that she put in chat, or she put a Q in chat. So Michelle, you want to ask your question?
Thank you. So Tiffany, going back to the house model, and we've seen this several times since Case Management Redesign kind of came around. I just want some clarity as both a provider and a parent. The way this house model is set up, my question is, if I'm a person who has just moved to Colorado or have a child that just got a diagnosis and I'm looking for services, will I be required to apply for that disability determination on my own and then go through the county financial eligibility on my own before I get to a case management agency?
That's a great question. I'm not sure that that I can address it in this meeting, but we can put it on our listening log and we will address that in writing in response. You're basically asking, at what point does case management come into the picture to support families?
Yes, and I mean, yeah, that's part of the question. My concern is, as a provider right now, the disability determination application and the financial process through the county is probably 2 of the most confusing pieces. And I worry that moving forward, members might have some obstacles just getting to the case management agency if they're required to do those 2 pieces without assistance from a case management agency.
Yeah, great call out. We will put that in the log. Thank you so much, Michelle.
Thank you.
Okay, and Michelle, I have that phrase as kind of a question. Will the CMAs provide support with the disability determinations and the financial eligibility determinations?
Perfect, thank you.
Okay. Okay, so in integrating the CCBs and the SEPs, one of the challenges is that right now they're paid in 2 different ways. For the SEPs, for the case management, they're currently being paid through administrative claiming, or we're just using the initial AM on there. And sometimes it's called Medicaid administrative claiming too. And because that's not an actual Medicaid service, the state isn't required to have the any willing provider requirement. Under the regular Medicaid program, if you're offering a service, you have to have let any willing provider who's qualified to provide the service and willing to take the rate provide that service. You can't limit the number of providers, but because this is done as an administrative activity, the state can provide it can limit the number of providers from that, and so that doesn't qualify. And Jose, I see you have your hand up. Is there a question that you want me to ask right now?
I can wait until you finish this part.
Okay. So the CCBs, they also do have some administrative claiming that they're doing under Medicaid. And then, however, they're also claiming under targeted case management. So under targeted case management, they receive some of the services. And targeted case management is a Medicaid service. And in most cases, it would be the any willing provider qualification would be required. However, there's kind of a quirk a little bit in some of the Medicaid regulations that allows states to limit the number of providers when the program is serving only people with intellectual disabilities or with a mental health challenge. So because the CCBs are just serving the IDD population, they can limit it. The state can limit it to just the CCBs as the choice without any special authorization for it. However, under CMRD, you're going to be having the CMAs that will be doing this, and they'll be serving across populations. So it's going to be serving a variety of different populations. So to address that, what the department is proposing is that they will be using a mix of the administrative claiming and targeted case management for it. So for the TCM, they will be that will be providing that once somebody is enrolled in Medicaid, that you can have that service and you can start billing on that. And they're looking at TCM over attaching it to a waiver, because theoretically that could be part of a waivers, because that would be simpler. Because if you do it for a waiver, you're going to have a separate service code and billing code for each waiver versus TCM. You can be, just have one code, and that's going to be simpler. In addition, with TCM, you can bill before somebody gets on a waiver. So for some of those activities that once somebody's getting enrolled, when you're helping them to choose a waiver and conducting an assessment and so forth, and they're not technically enrolled on a waiver yet, you can bill that under TCM as long as they are on Medicaid. Now, they're looking at TCM over the administrative claiming because under administrative claiming, theoretically, you're supposed to only just be coordinating Medicaid services, whereas TCM, targeted case management, you're allowed to coordinate across the person's entire life. So you can coordinate access to schools, or you can coordinate on community integration and things that aren't covered for under Medicaid that you can get the reimbursement for that under the TCM. Now they are looking at doing more of the administrative claiming for the other costs that are considered Medicaid related. So like that's a good question that Michelle was bringing up. So if the case management agency was going to be helping somebody that they first contacted the agency and they were going to be looking to get help doing the developmental or getting the disability determination done or filling out the paperwork for the financial eligibility, that if that are going to be things that is a requirement that the CMAs help out, the state can get the administrative claiming dollars for that, so they can get a 50-50 match for it. So in kind of considering all of these factors for the simplicity, for drawing down the maximum amount of Medicaid match for that, they're looking at using targeted case management and the administrative claiming as the funding sources for this. Now, because in this case, you're applying TCM beyond people with intellectual disabilities, because you're going beyond that, you need to be able to waive that any willing and provider requirement and limit it to the number of providers that would be authorized under the competitive solicitation for that. And the authority for being able to do that is called the 19B4 waiver authority. And Julia is going to talk in more detail about this. that's just the overall rationale in terms of what were the Medicaid funding authorities that kind of made the most sense for case management redesign. So I'll open it up, and Jose, you want to ask your question now?
Can I just add really quick?
Yes.
This does not mean that any of the 1915C waivers are changing. All of the 1915C waivers will still be running as they have been. This is just an addition for case management specifically to waive the any willing provider, that requirement.
My question is about, it's a question / comment about the case management choice. In the presentations that we have been doing about the CMRD, that, by the way, were vetted by HCBS, we have insisted and talked about freedom of choice. We have talked about person-centeredness, and we have talked about the fact that the new case management redesign and the new tool allows for more freedom to choose what's your right. For example, choosing a different case manager. And if this is not working, because that's part of the grievance process, right? So even if it is within the same CCB or SEP or whatever, you know, you just like, okay, so-and-so is not working. I tried talking to her or him, and it's not working. I talked to the supervisor, she or he, you know, yield and said, you're right. And he or she gave us a new one. And that happens. It happens. And it's a reality. So I kind of want to make sure that you guys clarify that. And also that we don't just say as a blank statement, no.
Agreed. Jose, we will be talking about that process, specifically the grievance process, the exceptions process for changing case management agencies or selecting a new one, the portability process, where if someone moves across kind of a neighboring boundary, what that process will look like. We're going to get into that with the case management rules. But I do want to confirm for you that yes, we are incorporating the requirement for case management agencies to have that as an option for people to change case managers.
Okay, thank you.
Mm-hmm. Okay.
And Jose, I'm
Oh,
entering that just in the listening log, just saying like the rules should allow for clear options and processes for people to change case managers.
Great. I also just want to mention that there is there's quite a few comments in the chat, and we are taking those. We'll take those comments too and make sure that those are logged in our listening log. All right. So I think we are ready for Lee Ray is asking, can you clarify changing case manager or changing CMA? Lee, we will have policies or require case management agencies to have policies and procedures for both changing case manager, individual case manager, and a change of case management agency if that relationship cannot be repaired.
Okay. And I've amended the one for Jose's to include that.
Sounds good.
And I don't want to take John Berry's role, but Charlene asked a really important question. This question that have been sent to the listening log are super important. When will this be discussed?
Yeah, so we don't have specific timelines on when we will have responses in writing, but as I mentioned earlier, at the end of each kind of section of rules that we review, so right now we're doing waivers and then case management. At the end of that, so I think it's January 31st, there is a follow-up session where no rules will be presented, but we'll revisit the logs and review answers and take any other feedback about those answers.
Tiffany, this is John Barry. I'm a little unclear. I have been monitoring and seeing all the comments that have been in. It seemed like we were maybe moving forward, but I will be glad to ask for more names for the queue if that's what you want at this point.
Yes, I'd really like to raise my question verbally. I think it's been missed. This is Charlene.
Okay, I'll take that as a yes, Tiffany. So Charlene, please go ahead.
Go ahead.
Well, I have been a member of many of these stakeholder meetings, specifically on the assessment tool and some other things that the department is trying to make across all waivers. And while I appreciate the efficiency and how this looks in terms of department organization, the reality of it is quite different. And I think some of the questions that have been put in here that have now been sent to the listening log raises the issue that I've had across many stakeholder meetings with this model. And that is that those things end up in a parking lot, a listening log, whatever you want to call it, and they never get discussed. Or they get discussed 5 minutes before the rule's finalized. I think we need to bring those up now. Those are fundamental structural questions. And I think that this process will break down almost instantly if we don't address some of them. And those are coming from people, many stakeholders from many different parts of the system. It isn't a single stakeholder group. I would point that out too. And as a person who's been involved in this for over a decade, I put that forward and ask you to take this wisdom and experience and put that to work here so we can have a successful process. Thank you.
Thank you, Charlene. So like I said, we're going to revisit all of the comments and the responses from the department at the end of each section of the rule reviews. So for waivers, that is December 6th. For case management, it will be January 31st. For benefits and services, that will be April 11th. We will also be creating other meetings that will come out of those comments and questions. We will also be digging deeper into some of these questions that have been raised today, which is why we're not answering them. But we will be addressing them in a deeper way when we actually get to the rules that will address them. So I really appreciate your comment and want to learn from other mistakes that have been made in other sections. I hope that answers your question.
Well, if I could just point out, and then I promise I won't make any further comment, I would just like the discussion to take place. That discussion so that different stakeholders from different perspectives can offer their view of this thing. That's what makes for an effective process. And what happens when these things get sent to the parking lot, the listening log, whatever you want to call it, is that never happens. And I think for the department to really understand what's going on here, and for us all to understand each other and our respective challenges, that process is important and it never happens. And that's a big problem. Thank you.
I understand. Thank you, Charlene. I will, we will talk as a team about how we can try to make that happen.
I
Okay.
want to echo what Charlene said. This has been our experience, especially since the department hired HCBS strategists.
Great. Thanks,
This is-
Jose.
This is John Barry. Anyone else want to get their name into the speakers queue at this point? And Tiffany, if you don't want to go that direction, just stop me. You can raise your hand in the webinar. You can unmute your phone to give me your name. And Jose, I appreciate your mentioning about the typing thing. If anyone is having trouble with the typing, I'm going to ask for that more often. Anyone at this point? Or you can put your name in the chat. Anyone? Okay, not hearing or seeing anyone, Tiffany, and you mentioned about capturing prior comments in the chat, so I'm not going back there. Of course, if you want to.
Have a hand raised.
There's a hand raised, thank you. Jen, please go ahead.
Yeah, I just wanted to say I also have trouble typing. So we need to remember that disability a lot affects typing.
Understand. Thank you very much. Anyone else want to give us your name and make a verbal comment? Or again, you can type your name in the chat or raise your hand. Okay. Thanks everybody for the moment. Tiffany?
Yeah. All right. So I am really happy to introduce you to Julie Masters from our Waiver Administration and Compliance team. And she is going to get into some of the details of these waivers that we've been talking about. Julie?
Thanks, Tiffany. If you can go ahead and go to the next slide. So I'm here to talk about the federal requirements to make case management redesign happen. So I'm going to go over our 1915C waivers, the 1915B4, a selective contracting waiver, and then the state plan amendment for targeted case management. Next slide, please. So just some basics about the 1915C. That's for our home and community-based service waivers. Here in Colorado, we have 10 waivers. We have 6 waivers for our adults and 4 waivers for our children. Sarah is going to help me out by throwing a link in the chat box here. The link includes links to all the websites for all the waivers, including waiver charts, and then it also includes the most recently approved waiver applications if you want an opportunity to take a look at those. Next slide, please. So for the 1915C waivers, what they allow the states to do is waive certain Medicaid program requirements under the HCBS waivers. So that includes like statewide-ness, comparability of services, and income and resource rules applicable in the community. Next slide, please. So what do we need to do for the 1915C waivers for case management redesign? So we need to update all the waivers, and the main updates will be in appendices A and C. Appendix A is our contracted authorities section, and Appendix C is the list of our services. And then we will have a 30-day public noticing period when prior to submitting these waiver amendments to CMS, and we anticipate that will be from February 2nd to March 3rd. And when we have the public noticing periods out for public comment, we do post them on our public comment page. And we also send out an informational memo through Constant Contact. And then I think Sarah was going to put the public comment page for me in the chat link as well. And then we anticipate submitting the waiver applications to CMS in March of 2023. And then we have a requested effective date for those waiver amendments of July 1st, 2023. So that is on the 1915C waivers. Does anybody have any questions on those?
So if you do, please place your name in the chat or raise your hand in the webinar. And for those who prefer, you can unmute your phone right now and give me your name. Anyone? Julie, seeing nothing, hearing nothing so far. Let's see.
Okay.
Jose is asking, are you going to include the changes in these meetings?
The changes that I'm sorry. The changes that we will have in the waiver applications, those will be posted during the public noticing period. We don't anticipate posting them before that time.
Thanks, Jose. Anyone else? Looks like someone from the ARC of Arapahoe and Douglas.
This is Carol Meredith. You said it was going to go through A and B of the waiver application. Is that correct?
Mostly A and C. So A is our contracted authority section. So there's a small section in there that needs to be updated, saying that it's the waiver, if it has the administrative authority, that it will be targeted case management instead. And then Appendix C, just again, the same thing, saying that it's the waiver will be targeted case management instead of administrative.
Thank you. Very helpful.
Jose Torres, please go ahead.
Yeah, what I wanted to say is goes a little beyond what I can type. My question earlier about including these changes so that we can see them. I know that you said you're gonna post them, and that's okay. However, since we're bothering to be in these meetings, I will suggest if you could present the changes here so that we don't just have to, go hunting for them on your website, because I get it that it's in a specific place and I appreciate that. But since you don't send emails about it, specifically for example, the group that is participating in these meetings, specifically, for example, and you are not using us as CCDC to reach out to the community, since we are handling a bunch of subcommittees and stuff. I would suggest if you could include some of these changes so that we can discuss them and see what's going on, because this is one of my fears. Since this is a fast-paced change, and we get why, but it's still doable. Sorry, my audio is cutting out a little bit. It will be kind of important to be able to comment on the specific changes that are happening or will happen, so that we can say, hey, this is going to hurt people, or hey, oh, that's okay, whatever it is the case.
Thank you, Jose. Yeah, I can definitely coordinate with Tiffany and talk to her about that, and see what we can do.
Okay, and I've added that to the issues for further discussion. So that'll be for the department to decide whether they want to use one of these meetings or schedule another meeting to present the actual language.
Thank you. This is John Barry. Any other comments, questions at this point? Or Julie, do you want to move forward?
I see a hand raised from the ARC. Is that still, was that old or is that new?
That was Carol Meredith.
Okay. I can continue.
Very good, thanks.
There is a question. Sorry, there's a question in the chat.
I see one from Kimberly asking, are you sure that all final changes to this case management redesign will be made, and then we have 30 days public notice to, and do what? I think is the question also.
Sure. So I apologize. First of all, I have a cold, so my voice might start to sound a little bit different here. But so when we have waiver amendments or renewals, we always are required to have a 30-day public noticing period, and is when we get feedback from stakeholders, and then we provide responses to any feedback for any changes we make in the waiver applications, so that the February 2nd to March 3rd is when we have that public noticing period posted, and receive that feedback, and everything is posted for review. And then after that is when we submit the waiver applications to CMS.
And Julie, this process happens and has been happening since we have had waivers, right? It happens every 3 years, 5 years. Can you remind us?
The waiver amendments, we do them twice a year. So they have requested effective dates of July 1st and January 1st generally. We've had the same process going on probably about 3 or 4 years with the 2 requested effective dates. Generally for the July 1st date, the public noticing period is generally in February, and then for the January 1st date, the public noticing period is generally in August to September.
Great. So the changes that Julie is talking about to the waiver amendments that are impacted by case management redesign is just the waiver applications. So it's the final changes to the waiver amendments will be made and then posted for public comment for those 30 days.
Should I move on, Tiffany? Should I go on?
I see one more question about changes in the TCM model from S#. Does that mean there will no longer be the fee for service payments and PMPM payments like the SEPs receive now for case management? So we're going to talk about rates and payment structures when we talk about case management. So would it be okay with this person if we put that in our log and address it when we talk about case management? Yes,
Looks like we have the yes.
Sounds good. Okay, yeah, Julie, keep going.
Okay, thanks, Tiffany. So next is the 1915B4 waiver. This is a new waiver that we will be implementing. It's a selective contracting waiver. This allows the state to restrict providers of case management in a designated service area. Next slide, please. So the selective contracting waiver will be utilized for the BI, CHCBS, CIH, CLI, and EBD waivers. And the reason being is that, so for the remaining waivers, CES, CHIRP, CMHS, DD, and SLS, that is ready to waive through the freedom of choice exception, which is in the targeted case management in the state plan. The freedom of choice, it targets specific groups of eligible individuals with developmental disabilities or with chronic mental illness. And the providers are limited to qualified Medicaid providers of case management services capable of ensuring that individuals with developmental disabilities or with chronic mental illness receive needed services. And next slide, please. So for the 1915B4, this requires a 30-day tribal consultation period. We anticipate submitting this to CMS in January of 2023. And the 1915B4 will have a requested effective date of July 1st, 2023. So like the 1915B4 and the targeted case management state plan amendment, which I'll be discussing next, are submitted slightly earlier than the waiver amendments, the 1915Cs, as the 1915B4 and the targeted case management state plan amendment need approval prior to getting approval of the 1915C waivers. Any questions on that?
If you do have a question, this is John again. You can type your name in the chat, raise your hand. Kelly, I see your hand, will get to you. Or you can unmute your phone right now and give me your name.
Hi, it is Kelly Durant.
Yes, I know. I'm just seeing if there's anyone. Hang on one sec, Kelly. Anyone for the phone, put your name in. Okay, thank you for that. Kelly, please go ahead.
Thank you. Julie, I apologize because I'm coming in as a parent of a child that receives services, and I don't understand what this new waiver will do because my child is on one of the 5 waivers listed on the previous slide that will be affected by this new 1915B4. Can you help me understand as a parent how this is going to affect the services and the waiver, and what does this new waiver do in the processing of those 5 waivers that are affected?
Sure. So it's not going to affect the services in the waiver, but it's going to affect case management. And Tiffany, do you mind jumping in a little bit on that one?
Yeah, agreed with Julie. There will not be any changes to services. This just limits gives us the federal authority to limit the case management agency. And so what this will do is it will, we will be sending out a request for proposal where case management agencies can bid on specific areas of the state that they want to provide case management to. This will be a competitive process. It will go through our kind of unbiased panel at the department, and case management agencies will be chosen through that. It does not affect eligibility. It does not impact any kind of services or change services. It's just the authority to selectively choose case management agencies in a designated area.
So
your
kind of, and when I sat through some of the meetings last year about the boundary redesign and stuff like that. So this is just putting into law, more or less, that the state is going to go from 44 case management CMAs down to 25 or whatever the numbers are. Is that what this is doing? Is just saying we're only going to have a certain number?
That's right.
Okay.
That's right.
Okay.
Yep. Yes.
Thanks.
Mm-hmm.
Thank you. Next up, we have Charlene in the queue, and then we'll get to Julie Miller. Charlene, go ahead, please.
I think my question's along the same line. I realize this doesn't affect services, but it does affect an ability to choose your case manager. So, for example, if you moved and you were now in a different region of the state, it would be mandated that you had to go to the case management agency, whatever that might be, and then have your case management services provided from that designated area. Is that correct? Am I getting that right?
So what this does is give the state authority to have selective contracts. What that means is that, like I said before, it will take us from 44 agencies down to 20. We will have one case management agency in each designated service area. If, in your example, someone moves, we will have policies in place for what we're calling portability. So the ability to move between catchment areas, between designated service areas, and maintain your case management agency. So the our federal authority does not limit what we would allow. It just gives us the ability to have that selective process.
Okay, I'm still not clear. If we moved, and I have a daughter who's currently gotten on a waiver. If we moved, and would her case management services have to move, or would that current case manager be able to continue to provide services? Would that be allowed?
So it would be allowed under this waiver.
Well, okay. So how does that work, though? Could the state or would there be requirements that would limit or would force a change in case management services in a situation like that?
So this is what we're calling portability. Is moving between catchment areas and wanting to maintain that original case management agency. So that's one of the things that we will talk about, a primary goal of our discussion around, one of our primary goals around our discussion for case management agencies requirements is exactly what you're talking about, fleshing out what exactly that means and what that looks like in our rules, what will be allowed, what will not be allowed, will there be exceptions, will there not be exceptions. We are currently incorporating exceptions to the moving of case management agencies, and we'll have that in place.
So you're saying that those rules and that ability, that flexibility, if you will, has not been decided. That is a part of this process. Is that correct?
That's right.
Okay. And in that case, can you also, one more clarification question is, back on the other slide, there was an exception made for DD under, one of these rules. I don't understand that. You said that they were previously accepted. Can you please clarify that for me?
And that's a nuance within the CMS regulations within it, that for case management, that a state can choose to limit the number of case management providers for programs that only serve people with developmental disabilities or people who have mental health issues. That's what allows the Colorado, for the current CCBs, to limit the TCM, the targeted case management, to the CCBs only, and not opening it up to any willing and qualified provider. Within the waivers, I know the waiver language is confusing, but within the CMS terms, they're called waivers because they're waiving some of the Medicaid requirements. The home and community-based waivers, also known as the 1915C waivers, are allowing you to waive a few different components, like they're allowing you to provide services that people don't get into the regular plan, and change some of the financial eligibility so that you can qualify with a higher income. The 1915B4 is also waiving just a Medicaid requirement, and that one Medicaid requirement is that any willing and qualified provider. So it's allowing a state to limit the number of providers. Doesn't change anything about the programs or anything about the services, other than just saying that the state doesn't have to allow any case management agency that's willing to take the rate to provide the service, that they can do this contract where they're selecting a subset of the case management agencies to have that greater efficiency.
That will continue then with this new program. So in other words,
yes,
those waivers that were shown in that second bullet would be allowed to continue. The state would be allowed to continue to limit the case management providers in those. Okay, I appreciate that. And how, and can you, is this timetable for a January rule change, does that include all this discussion I brought up in my first question, which was what the flexibility would be? Are those all going to be included in that rule?
Well, that's a separate component, and I've captured on the listening log your question about the portability and switching the case managers. And I think that's going to be much more helpful if you see the actual draft rule language, and you can kind of see what the department has written, and then you can react to that directly. So I've got that in the listening log. I've got that flagged to a component for the CMA rules. So that way, when we have the meeting to go over that, you can see the exact language that's being proposed.
Okay, well, my final comment then is earlier point. That's really fundamental. And to leave that in a listening log is a huge mistake. So that's my comment. Thank you.
For the listening log, we're actively going to be using that. So as we're going through each of the components, looking through the rules, we're seeing what we can close out, what has been raised by you guys. And that way we can kind of highlight that here's the language within it that addresses that concern. And you can see what changes made. And also if there's something that you brought up in the listening log, we're going to make sure that there's actual language in there. So you brought up the stuff about the rates and that being in the CMA section. So we'll be looking in the rules to try to highlight that section. So we're going to be very actively managing the listing log and trying to close out everything that we can.
Okay, thanks. This is John Barry. We have a number of people still in the queue. We're going to move to Julie Miller.
Hi, John. Thank you. I think that most of my questions have been answered at this point, but going back to slide 24, is that when you were talking about restricting the providers and all that, that's the providers are the case management agencies in the designated areas, right? Okay.
Yes.
Yeah, I think I'm good at this point. Thank you.
Thank you. Next up is Kimberly. Kimberly, please go ahead.
Hi. Thank you for providing this opportunity. I really appreciate it. I've been on some of the other boards that we've had, and I appreciate it. My question, I guess, is I haven't heard about a reason at all in all these discussions of why you decided to restrict agencies. So I would like a reason for that. And then two, why did you decide to put this language in as restricting the number of agencies versus doing like a certification or something like that, where like I understand what you're saying as far as like you don't want just anybody to offer these services, because, and I've experienced it as a parent of 2 children with special needs, that some of them are not providing high quality services that the state wants for these kids. But you're also weeding out some amazing agencies as well. So why didn't you just decide to go through like a certification process or something like that, so that you have I think a lot of the concerns from the parents are mainly this monopoly looking structure. My husband's been in the military for 20 some years. I understand big government, it doesn't work. And so it's not necessarily the best thing for parents and needing the ability to choose. And I can provide examples for that, but I don't want to waste anybody's time. I just think that that's the main thing, is this wording of you're restricting people's choices. And I mean, as parents of special needs kids, we have choices in doctors, and that's always a good thing. And so I think if you can address this monopoly type situation for each area, I think that it would relieve some concerns.
Yeah, I can take that one. So I think it really goes back to that background and not trying to uncomplicate a very complicated system. Again, that I wasn't a part of that process. I'm sure a lot of you were a part of that process of creating the filters that our the department's leadership used to make these decisions. These were not decisions that were made lightly or without an understanding of impact, but really wanting to create simplicity and have that quality case management across the state. And so again, looking at other states where they did do a certification process, or they did, kind of have a like free open market of case management, we're seeing pretty negative outcomes from those situations. People losing services, falling through the cracks. And so I can definitely appreciate your sentiment about, big government and big agencies and those kinds of things. We will definitely take that under consideration and take that back to our team. That is, that's kind of how we got here.
Yeah. There was also another major concern about supporting people in some of the more hard to reach areas and some of the more rural and frontier areas, or places that had more geographic challenges. And that if you had it open to everybody, the case management agencies there'd be a lot of competition, like in the Denver area, and where the people are more easy to serve. But for the people that are more challenging to serve, you kind of need to have the volume in the other places and in the other cities to be able to have the infrastructure to serve throughout the entirety of the state. So that was another major goal of having the case management redesign.
Okay, thank you. This is John Barry. Marie, you had a question. I'm not sure if it's been dealt with. It was about one waiver versus all waivers. Has that been answered in the discussion, or do you want to speak that question? Marie? Okay, I will, waiting to hear from her and move to Patricia. Patricia's asking, right now they have to move this They have to move this as giving you the option to keep your certified nursing assistant, correct?
I think it was CMA.
CMA, Case
Yeah.
Management Agency. That makes way more sense. And I butchered the question, apologies. Right now they have to move
That's
this,
okay.
giving you the option to keep your case management agency. Is that correct? Thanks,
That's
Patricia.
right. Yes.
Okay. And then Michelle, I beg your pardon, is asking, will there be discussion at a future point about the quality metrics that will be measured to ensure that selected case management agencies are providing high quality services?
Yes, we'll address quality measures and support in department support for quality with case management agencies in the case management agency rules expectations, that section.
Okay, and I'm catching up with Michelle here, also asking through the RFP request for proposal process, how long will the awards contract period be? When that contracted period is complete, will there be another opening for RFP, question mark?
So I can't talk about the contents of the RFP, which answering that question would provide some of that the contents. But once we get to the case management rules, we will be talking about lengths of time, and at that point the RFP will be public, and so we'll be able to talk about that in more details. So we'll make sure to capture that question, Michelle, and make sure that it gets answered in future meetings.
Okay, thanks, Tiffany. It looks like for the moment we are caught up with all questions and comments that I'm aware of. Do you want to move forward, ask for more?
Yes,
on the queue, John.
We have someone in the queue. Go to the queue then, Tiffany.
Jerry, please. Jerry.
Oh, Jerry in the queue.
Oh, I beg your pardon, Jose. I didn't see her name. I beg your pardon. Jerry Froney, please go ahead.
Thank you. I want to address something on slide 27. It's under case management activities include, and it's the third arrow down, assisting members with obtaining needed services. Okay. This idea of having a slippery slope between case management functions alone and service provision alone, which is a goal, a separation goal from the federal government. I have a real problem with the slippery slope of assisting members with obtaining needed services, because I feel that sneaks into the element of discussing service providers within a case management meeting between a case manager and a Medicaid member. And I personally, because of the history of conflict of interest in Colorado, I find that it will be darn near impossible to keep conflict of interest from creeping in when you have that discussion assisting members with obtaining needed services. Now I know that, HCBS is going to make a million different protections, and those will all, we'll get to see all of those between now and April. But I don't honestly feel that we're going to cure the conflict of interest issue. And you can put this in the listening log, which Charlene, I agree with Charlene, is just a permanent parking lot to, you know, kind of dissipate questions from stakeholders here. So anyway, I just want to alert folks that I think the idea of ending conflict of interest is a pipe dream. Thank you.
Thanks, Jerry. Julie hasn't had a chance to go over the slide, but I want to give her that chance. I see we have a hand raised. Do you want to give your comment now or wait until this is done?
Well, I just want to mention that, like with my case manager at HCMI, assisting members with obtaining needed services meant her just giving me a list of names so I could call them. So I kind of feel like that should be more defined.
Yes, thank you for that comment. We'll address the fleshing out of what this actually looks like operationally for case managers, again, during those case management rules. So Julie's just going over that overarching authority that we have to do these tasks, and what that actually looks like is up to us in the rules.
Okay, thank you.
Yeah. Julie, why don't you go ahead with the rest of your slides?
Okay, thanks, Tiffany. So for the next one to discuss is the targeted case management in the state plan amendment. So this is the federal definition of targeted case management. It's targeted at a specific population, and the case management activities include completing the assessment, developing the person-centered support plan, assisting members with obtaining needed services, and monitoring. Next slide, please. So targeted case management we do currently utilize for the CES, CHIRP, DD, and SLS waivers. And with the redesign, we'll be including the BI, CHCBS, CIH, CLLI, CMHS, and ABD waivers to have targeted case management. And we'll be updating the state plans through an amendment to do so. And next slide, please. So the targeted case management state plan amendment, it requires a 30-day tribal consultation. We anticipate submitting this in January of 2023. In the targeted case management state plan amendment, we're going to request an effective date of July 1st, 2023 with the Centers for Medicare and Medicaid Services. And then the next slide just has my contact information and my supervisor's information if you have any questions on the federal requirements that we have to implement for case management redesign. And then I can hand it back over to John or Tiffany.
Okay, thank you. This is John Barry. If you have any comments or questions at this point, you can put your name in the chat, type it in. You can raise your hand in the webinar and I'll be scanning for those. And also you can unmute your phone right now if you want to make a verbal comment and I will take your name.
And Michelle Morris raised one.
Michelle, thank you.
So my question is for Julie or Tiffany. On this last slide that you had where you said that the anticipated submission date is January 2023 with a requested effective date of July 1st, 2023 for targeted case management to be implemented for the additional waivers. Does that mean that as of, if you guys are requesting a July 1st, 2023 effective date and it is approved, does that mean that as of July 4th? Sorry, that's very just, I don't know what that was. Does that mean that as of July 1st, 2023, that current agencies that are providing case management, not under targeted case management, would have to switch over to that?
Great question. Julie, you can interrupt me and kick me under the table if I'm wrong. What we have worked out is that we will have dual eligibility, dual authorities for the fiscal year 23-24, as the department works with case management agencies who have been awarded the RFP to do their transitions throughout that fiscal year. So no, current case management agencies will not be required to switch over. It will stay as is until that transition period. So this gives us the authority as of July 1st, so that when contracts need to be started, we have that federal authority. And then the sort of quote unquote old authorities will roll off July 1st, 2024, and these new authorities will be in place.
Thank you.
Okay, thank you. We will go to Kimberly and then Ellen Ginsby. I'll read your question out. Kimberly, please go ahead.
Hi, it's me again. So I just want to clarify, kind of a follow-up on my last question. I know you have the ability to restrict agencies, and that's what this waiver amendment is doing. Will you restrict it to one agency per area? Is I guess my question.
Yes, so if we can drop in the chat the memo that defined the service areas for case management, a little over, well, I guess about a year and a half, a little more than a year and a half ago, the department went through a process with stakeholders to create defined service areas. And so each service area, yes, will have one case management agency designated.
Okay. Yeah. Okay. So I don't really agree with that. I don't think a lot of people agree with that, but so I just want the record to state that I think that's a bad idea. I think that's a bad idea because, and I saw it on the slide, my daughter's on the CES waiver. And so I've been dealing with TRE, and it took me 6 months to get her services. I went through 3 different service managers. I had to talk to 2 different supervisors. Nobody called me back. It was not easy. And I don't have the ability, if I want to keep her on that waiver, to change. And I just think that it's just not a great idea. I have people complain about that organization all the time, and nothing has been done to remove them, change it. People actually avoid putting their kids on the CES waiver because they only have one choice. I'm not saying that you need, 20 service agencies for one region, but we do need a choice. We need other choices. I can't reiterate that enough, and that's it.
I hear you. Thank you for your comment.
Thanks. This is John. So I'm catching up with the chat here, going back to Ellen. Ellen had a question. Ellen Ginsby. So much going on in the chat, folks. I apologize. Ellen, is there something
John,
that you say out loud?
I'm sure I can just ask it. Steve in the chat indicated that TCM will be the Medicaid authority for case management activities, which I'm assuming it's the 4 activities that have always been listed for targeted case management. And then you referenced that other activities would be covered by administrative claiming. I'm just wondering if you can give some examples of what those activities might be. Thank you.
Yeah, and I think that those are in process and being determined and kind of fleshed out. So, and I haven't been involved in those discussions. So I put in for the issues for further discussion, a request for the presentation to be done on the activities that would be done under administrative claiming, and potentially the changing, because Nancy had a comment about the billing codes for TCM. So I think that what we could do is, like, with the people that are overseeing that, propose that we do like a separate meeting that would just kind of go over what's the draft thinking on that. And they may not even be able to do that just because they're in the RFP process. But if they are, we can talk to them to see if we can get a meeting that will provide you guys with more information on that.
So this is John, and I am trying to catch up with the chat here. Charlene said, amen, Kimberly. It's not a great idea to be restricted for CMA. KM asking, how many areas can one agency serve? Thank you.
So I think that's Kelly Morrison. How many areas can one agency serve? So again, that is part of the RFP. So I can't release that information, but we will be talking about that. We'll definitely put that in the log and make sure that we answer that question. But that will be part of the case management discussions. Thanks, Kelly.
Thank you. And Megan it's bouncing around on me here. Sorry. Megan is asking, why did HCBS decide to go back to targeted case management billing after working so hard to get away from it?
Yeah, great question. So targeted case management is the authority, not necessarily what we do for the billing part of that. My understanding is that there's some flexibility in that. So this is not us going back to 15-minute increments. Again, this is just the authority to bill for particular activities through the state plan. We can answer that question when we get to more fleshing out the rules around targeted case management and talking about rates and billing. So happy to revisit that.
So I'm looking at two questions in the chat. Abe Becerra, apologize, I don't recall your first name. Is there a link to the listening log so that we are aware of issues and questions already raised to HCBS?
I just sent it, John.
Oh, great. Thank you, Jose.
And Nancy Vigil is asking, can you clarify what activities are included under each targeted case management activity?
Again, that gets back to, we'll see if we can have a separate meeting on that to kind of go over those components. I think that would be especially relevant for the case management agencies now.
Thank you, Steve. And I believe I'm caught up to the present. If not, I apologize. Ailsa is asking, will intake and eligibility be funded by targeted case management, and will it include the evaluation required?
Yeah, that goes into the specifics of that. So I think we want to defer and see that if we can have a meeting with that.
Understand. Rob is asking, all of this relates to the targeted case management / case manager changes, but included in the case management agency house is a variety of other functions, including quality assurance, state SLS waiver, supported living service, family support services program, I believe, etc. Are there proposed changes to the funding and rules for these functions?
I can take that one. The short answer, Rob, is yes. And we are still working with our rates team and our budget team on getting all of that kind of squared away to present and make public. So I don't have specific answers for you right now, but I can tell you that those questions will be answered in the coming weeks, if not in this meeting, then in other meetings. And we'll make sure that this group gets invites to those meetings.
Thanks, Tiffany. This is John. I will ask for more questions, comments, if you feel there's time right now. Should I go forward?
Yeah, I think we have time for a couple more comments or questions.
Very good.
And then we'll do our wrap up.
So folks, if you can raise your hand in the webinar, you can type your name in the chat right now or unmute your phone and give me your name. Either of those three. Anyone? I'm hearing people in the background, but no one. Anyone else?
Mama.
Okay, Kelly Durant, please go ahead.
Thanks, John. The invitations, Tiffany, that you just mentioned to address Rob's questions, I know you said it'll be sent to this group, but I know there's lots of people that belong to some of those programs that aren't on this chat or this meeting. And I know in the past, HCBS has not directly communicated with the recipients of the services. There's always medial other levels in between, and that doesn't always trickle down. So when, like, for all of those people that are on the FSSP plan or the state SLS plan or any of those, will you guys be pulling the information of the people receiving the services specifically and letting them know directly that there are changes in the works?
Great question. Yes, our intent is to reach out directly to all members that are impacted by these changes, to invite them to these stakeholder meetings. We are working with our communications team to figure that out. I have also been in touch with the ARCs, and I know they have a vested interest in supporting direct member involvement. I'm happy to add you to my list of people to help support with figuring that out.
I mean, if you just reach out to all your current CMAs, right? All your CCBs, all your SEPs, all your CMAs, they have a list of all of their clients who are receiving all of these services. And I don't think that's ever been done in the 10 years that our family has lived in Colorado and been on services. And I think that's super important that these people are, my CMA has contacted me at times, like that's how I found out about this whole series of meetings that was happening, but never once did I hear from HCBS. Never once did I hear from a state agency other than my direct CMA, because they care about me. And they're unfortunately in that group that's going to be going away, most likely. And I appreciate what they do, because they seem to care about me more than HCBS and the state of Colorado does.
Thanks, Kelly.
Tiffany, this is John. You mentioned one or two more comments, so I believe we have the second one. Elsa is asking, a few added meetings have been suggested. How will you know who to invite to these breakout conversations? Thanks, Elsa.
Yeah, thanks, Elsa. So we use John Barry's constant contact list. We also will use the attendance logs from these meetings to create that invitation to email out that information to this group. I'll talk based on Kelly's information and feedback. I will also talk with our leadership about how we can better engage with folks that are directly impacted by these changes.
Tiffany, that brings us to the end of the second one. So I believe, given what you said before, we may be at the end for the moment for comments and questions.
Yeah, I see one more hand raised. I don't know if we have another, any other comments.
I'm looking in the chat. In the meantime, Jen, would you please go ahead?
Yeah, I just want to agree with Kelly. It feels like no one ever controls the actual consumers, and we're the ones that benefit from it. So we need to fix that. I know it's trying to, but yeah, we need to have more influence from the actual consumers.
Great, thanks for that, Jen. Really appreciate it. That is all we have time for. I wanted to just touch on, we know that there are a lot of projects that HCBS has going on. So the best way for you to stay up to date on these meetings is through the Case Management Redesign webpage and our stakeholder engagement calendar. We are going to be canceling the December 20th meeting for joint budget committee requirements and needs around that time. So you'll see that change reflected in the calendar and on our webpage. But please go there for updates. We'll be updating, the meeting information will stay the same, but we'll be updating the dates as we need to. And I will put my contact information in the chat, and Nicolette will do the same. If you all have more information, more comments, more feedback that you want us to make sure we're addressing in these meetings, please feel free to email us directly, and we're happy to take that into consideration. Otherwise, thank you so much for your time and your comments. We really, really appreciate all of you and your time. Thank you so much. Have a great day.
Thanks, you too. Bye.
I'll put the link in too one last time for attendance for anybody that wants to be able to hurry and get in on that.
Thanks, Nicolette. Bye, guys.
Bye.